What's going on, everybody? My name is Golfran Alejandro Rivera. I am a certified physician assistant licensed to practice medicine in the state of North Carolina. And I'm also the owner and chief practitioner of medicine at TrueCare DPC. And it's come to my attention that a lot of you are not actually familiar with the concept of direct primary care, or DPC. So I wanted to make this short video to address at least 5 amazing things about direct primary care that may make it the very thing you've been looking for your primary care services. Number 1, the key word in direct primary care is direct. DPC gives patients the opportunity to have direct access to their practitioners. At TrueCare DPC, whether it's an email, a text message, a phone call, none of these things are going to end up at a phone tree or in the hands of a medical assistant. They're going to go straight to me. And when you come to my clinic, you're not going to be greeted by another staff member who asks you to politely wait in the waiting room while you fill out some paperwork next to somebody who's coughing or somebody who's sniffling or looks generally unwell, right? No, when you come to TrueCare DPC, I will greet you at the door with a smile while we get started talking about you, your life, and your healthcare needs. Number 2, no health insurance. And that's because direct also means direct payment. DPC practices like TrueCare DPC don't accept any kind of health insurance. No Medicaid or Medicare, no TRICARE, United Healthcare, Blue Cross, none. No health insurance. And I think that's the part that's most jarring for people that we try to wrap our head around, because we've been conditioned to believe that health insurance is essential for access to care. But that's not the case with DPC. In fact, it's by removing health insurance that we as practitioners are able to really focus on our patients, not get bogged down with proper billing codes or negotiations with insurance companies while we try to get paid. At TrueCare DPC, our patients who are over the age of 18 up to 64 pay a flat monthly fee of $99 a month, and their children from ages 5 to 17 is $25 a month. And that covers all your visits, whether you see me once, whether you see me 10 times, whether it's a scheduled visit or an acute visit for something unexpected, whether it's a routine wellness exam or a minor in-office procedure. All of it is covered by your monthly fee. You don't pay again until the next month. And as a bonus, if you really want to, you can still use your health insurance to pay for prescriptions, labs, imaging, and specialty referrals. Number 3, and this is a big one. DPC allows you, the patient, and me, the practitioner, to get our precious time back. Okay, at TrueCare DPC, because we do not accept insurance, we don't have to crank out a bunch of patients to make up for that lost revenue. At my practice, every appointment is at least 30 minutes long. And that gives me enough time to catch up with you, talk about your day-to-day, your family, all the different things you have going on that impact your health. And then we can also talk about your ongoing health concerns or anything new that's come up. It also gives me time to incorporate new therapies like manual therapy, exercise therapy, nutritional counseling. And this is really important, it gives us enough time for you to bring up any questions or any doubts you might have about the current treatment plan without feeling rushed because there's a bunch of patients waiting to be seen behind you. Number 4, I've already mentioned that DPC gives you direct access to me through emails, text messages, and phone calls. But what about a reasonable time to be seen for a scheduled appointment? Not 2 weeks, not 2 months. How's 1 to 2 days sound? Right? Because what happens if you unexpectedly get hit with a bug, or you roll your ankle when you didn't count on it, or God forbid, you didn't realize that you were running out of that essential medication? Wouldn't it be nice if you knew you could count on getting in touch with me in such a short amount of time to get taken care of for those things? And like I've already mentioned, because I'm not bogged down with insurance, I don't have to have a massive panel of patients to make up for that loss. I can keep my panel small, which leaves my availability wide open to address your immediate needs as they come. And last on our list, number 5, which is easily taken for granted, is the fact that DPC allows for continuity of care. See, big box healthcare facilities that rely on insurance payments in order to stay running have to maximize profits by getting patients in. even if they need to book them an appointment with a different practitioner because the one that they normally see is not available. And then what often happens is patients end up seeing almost every provider in the facility before they even get to see the one they first saw again. But that is not the case at TrueCare DPC. You're gonna see me, just me. I don't have any other staff. When we set up a follow-up appointment, you and me, you know who's gonna be there at that follow-up appointment? It's going to be me. On occasion, I'm gonna go on family vacation, or I'm gonna go do some training, or I might be sick, but I'm gonna communicate that to you well in advance so we can plan for that. And of course, if something unexpected happened, I'm gonna let you know and ask somebody to cover down, but that will be few and far in between. When you are a member of TrueCare DPC, you can rest assured that I will start your care and follow your care all the way to the end. Now, I know that this model of healthcare is very unique to the area and even throughout the country. But if you're in the Fayetteville, Hope Mills, Fort Bragg, Fort Liberty area, and you happen to be looking for a primary care provider, I ask you to please consider becoming a member at TrueCare DPC and enjoying all the benefits that direct primary care has to offer. God bless you all. Thank you so much for watching. And I would really appreciate if you like and share this video and help us get the word out of what we're doing here in the area through direct primary care. God bless y'all.